Hello, my people. Good day to you all. Today I come up with a new thing, with a new innovation and invention, which is called a Neurovitals smart headband, which I'm going to present it. Before that, I would like to introduce myself. My name is Nurse Abdurrahman Abdullahi Yabo, a nurse working in a male neurotrauma ward in Usman Danfodio University Teaching Hospital, Sokoto. Before I start, what makes me to invent this device is, as I'm working in a neurotrauma ward, I've been encountering with many patients who are having neurological problems, most especially patients with head injuries due to or as a result of road traffic accident. So without wasting of much of our time, I will start the presentation now. These are the table of content, which includes introduction, key features of the device, the diagram and the leveling of the device, the description of the device, as well as the impact of the device on neurotrauma patients. First of all, by starting with the introduction, a wearable smart headband designed to continuously monitor neurological and psychological and physiological indicators in neurotrauma patients to assist in early diagnosis, treatment, tracking and recovery optimization. What this point is telling us is that this device helps the healthcare personnel, that's the nurses and the doctors, to monitor neurological and physiological function of the patient. In order to assist the patient for early detection of complication or early detection of signs and symptoms of complications, in order to put patient on treatment and help the patient to recover. Then the second point is the key features of this device. Number one, it has a real-time neurological monitoring. This device, it has EEG sensors, that's electroencephalography sensors, which detect abnormal brain activities, which I made an example like seizures and intracranial pressure changes. It detects complications like brain swelling and secondary injuries, which can be hematoma, that's subdural hematoma or epidural hematoma. Number one, vital signs integration. It monitors heart rate, oxygen saturation and body temperature of the patient. This device will help the nurses to monitor the patient vital signs without stressing themselves by taking the vital signs materials or vital signs equipment to the patient bedside. Once this headband is placed on patient head, it helps the nurses to simply monitor the patient vital signs. And it has cognitive and motor function feedback, which includes motion sensors to detect limb movement or tremors, which help track progress in rehabilitation. What this point is telling us is that This device, it has cognitive and motor function which detect if a patient is undergoing physiotherapy. It helps the healthcare personnel to know if there is progress in the physiotherapy. And also, number 4, it has AI based data analysis, which it analyzes strength and provide predictive alert for possible deterioration or improvement. As I explained earlier, this device helps health care personnel to predict or to have much insight on patient health progress, so that they will know the line of treatment they will put the patient on. Patient comfort and safety. This device is comfortable for the patient because it has adjustable place where you can adjust, and it fits any patient head, so it's very comfortable for the patient. So this is the diagram of the device. The description of the device: it has electroencephalogram or electroencephalography electrodes, whereby it helps to detect brain wave activity, that brain electrical activities, where if there is seizures and other neurological problems. Integrated display models: it shows live data like brain activity, oxygen saturation, and alerts. As I explained earlier, it detects or it monitors patient vital signs. Then adjustable strap wrap around the head for secure pits. Yes, as I explained earlier, it has an adjustable strap where it comforts patient heads. So these are the impacts of this device on patient: faster detection, reduced manual workload, better communication, and improved recovery. In this faster detection, it helps the healthcare personnel to detect as early as possible if there is sign of complication, which can be tackled before it reaches to some higher extent where it cannot be tackled as soon as possible. It reduces manual workload. Like as I explained, it monitors vital signs without stressing nurses to be carrying vital signs equipment. It already has its vital signs monitor. Better communication: it gives an objective data which can help nurses communicate concern clearly to doctors. Improve recovery: tracking cognitive motor progresses, supports customized rehab strategies. As I explained earlier, it helps the physiotherapist to know if the treatment that they are given to the patient is effective. So in conclusion, as a frontline nurse in a neurotrauma ward, I encounter daily challenges in managing patients with neurological damage due to trauma. Timely diagnosis, constant monitoring, and effective rehabilitation are critical yet demanding tasks. I propose a trial of innovative technology-driven device to address these needs in patient-centered, nurse-friendly, and outcome-focused way. What makes me to invent this device is, as a nurse in neurotrauma ward, there are many challenges that patients there are facing, because you can see a patient who was in the ward for more than 3 months receiving treatment, and the progress of the treatment is going slowly. So the reason why I invent this device is that it will help the doctors and the nurses for them to have an insight on the care that they are giving to the patient. Thank you for listening.